Hello, nutrition students. I wanted to come on and talk to you about cardiovascular disease. I thought maybe this would help you with some of your testing and thinking with your assignments this week. We have this lecture plus our cardiovascular quiz. We have a lecture on lipids and fats and a little quiz assignment to complete with it. With those, please, I go through and correct any kind of, if you put 20%, put the percent sign, it will count it wrong just because it does. It's so sensitive about every little mark you make. So that's why I go through them and check them off. Please give me time to get all that done. I am behind on my grading. I've almost got all of your meal plans graded. That took me longer than usual. We had a lot of misunderstandings with those. So I tried to really provide you with a lot of feedback on those plans. And on this week's discussion, you are going to pick a disease listed from the discussion prompt, and you are going to make a meal plan specific for that disease. So let's talk about, what is a meal plan? A meal plan is a plan that is the best nutrition, the best diet for you to have in that given day. It is not what you ate that day. That is not what a meal plan is. It's where you plan out specifically your carbs, your proteins, your whole grains, your vegetables, your fruit, and you put them in a breakfast, lunch, and dinner. So going forward, please note that that's what I mean by a meal plan. So in your discussion, you will create a meal plan based on the disease you picked. And there are specific questions I want you to answer about the disease you chose. Please read the discussion prompt from the very first word to the last word so that you are answering each question, okay? Please do that for me. So let's get back to cardiovascular disease. So cardiovascular disease is the number one cause of death in the United States. Coronary heart disease is caused by atherosclerosis. It's a process of damage of cholesterol deposits in the coronary artery disease. Okay. When coronary arteries supply the heart muscle with blood become blocked, the result is coronary heart disease, or coronary artery disease, some people might say. If the blockage is temporary, that means it's due to increased activity and the body's increased demand for oxygen. The person may experience angina pain and sense constriction around the heart. So usually if someone is complaining of angina, the nurse would make sure they are resting and would be administering vasodilating medications, commonly to produce relief. They will also teach the patient about changes in diet and lifestyle in order to reduce the risk of heart damage later in life. However, if the blood vessels are blocked by arteriosclerotic plaque, or it has a blood clot or thrombus, or maybe by an embolism, which is a circulating mass in the blood, the heart tissue beyond the point of obstruction receives no oxygen or nutrients in the blood. And when this happens, the person exhibits signs and symptoms of a coronary occlusion, which is a heart attack. When the blood supply cannot be restored quickly, myocardial cells in the affected area die, and the medical diagnosis then becomes a myocardial infarction. So there's so much with coronary heart disease that can lead to so many other pathways. So here is the heart and the veins, the arteries. I know as an RN you have to be able to identify these things. So this is just a just a little, hey, I've seen this before, just to introduce you to the parts of the heart. So risk factors. Okay, so hypercholesterolemia, it's a long word. That is, high cholesterol, it sounds like. It's a major risk factor. Another major risk factor is arteriosclerosis. So that's fatty deposits of cholesterol. It's fat and other substances that accumulate inside the artery. Initially, the deposit material or the plaque is soft, but later, as it stays there, it becomes fibrous and hard. And the disease process interferes with the pumping of blood through the arteries in two ways. One way, the deposits gradually make the lumen, that's the opening of the artery, the whole of it, smaller and smaller. And then the fibrous makes it progressively harder for the artery to constrict and dilate in response to the tissue's need for oxygenated blood. So our vessels are constantly moving, and it can't do that with that hard plaque in there. When the lumen or opening through the artery is 70% blocked by the plaque, the person is likely to show symptoms of impaired circulation, distal or beyond the obstruction. So arteriosclerosis can be found in animal products, and that's why on your meal plan, I was talking to you about the amount of protein, animal protein we eat. So the recommended total protein that adult women have is usually 5 ounces, and in men, it's 6.5 ounces per day. That's per day. And we as Americans are used to having that amount of animal protein in one meal. So it's no wonder that we are suffering from cardiovascular disease if this plaque and saturated fat and cholesterol is found in so many animal products. So that's why we need to eat these things in moderation. We just got out of control. And we need to really follow the recommended my plate servings, where half of our plate is vegetables, and 1/4 of that plate is that animal protein. And we don't have to have it 3 times a day. We can use other measures of protein, such as legumes, beans, tofu. There's so many ways to get in protein besides animal meat. And so if you're wanting to reduce your risk of cardiovascular disease, following that guideline is a great way. Another great way is to reduce your trans fat, and that's found in baked goods, fast foods, because it's made from vegetable oils. We find a lot of trans fat in vegetable oils, and that's what all of the fast food restaurants are making your fries with, making your crispy chickens and your chicken nuggets. And imagine what a Happy Meal, how much trans fat a Happy Meal has. They've given your child, and they're having to push that fat through their blood system. So that leads to cholesterol. High-density lipoprotein cholesterol is the good cholesterol. It removes cholesterol from your blood and takes it to the liver. And low-density lipoprotein cholesterol is the bad one. Because it transports cholesterol out of the blood into the circulatory system, where plaque forms on our coronary arteries. Cholesterol levels for men, well, we want the HDL to be 50 or higher, and we want the LDL to be less than 100, and our total cholesterol less than 200. Hypertension is the other big factor for coronary heart disease. Hypertension is blood pressure, is the force exerted against the walls of the artery by the pumping action of the heart. That's what hypertension is. Blood pressure is recorded in 2 numbers. For example, that 140/90, The 140, the top number, is the systolic pressure. That's the pressure when the heart beats. And the bottom number is the diastolic pressure. That's the pressure between the beats. Both pressures are reported in millimeters of mercury. That's what mm is. Normal blood pressure, you'll see it in so many different ways. On your slide, it's saying if you are under 60, 140 over 90. Once again, this is one of those things that keeps changing, like cholesterol. That normal number has changed over the course of 10 years a couple of times. I think it's because we're trying to set a new normal. But some say normal pressure is 120 over 80. This slide says 140 over 90. And if you're over the age of 60, 150 over 90. So definitely don't want that bottom number to be over 90. 120 over 80 would be a beautiful blood pressure. Okay. What causes blood pressure? Sorry, I got off task for a minute. There's no real reason or clear reason on why we have high blood pressure. Sometimes it's just because we do. There's no clear reason. And then other times there's a secondary reason, maybe a response to another event or disease in the body. One such event could be pregnancy, during which hypertension may occur, or when you take medications, hypertension may occur, like birth control pills can stimulate high blood pressure. So we can also have high blood pressure because of other diseases from our kidneys, our adrenal glands, or our nervous system. So what can you do? Well, there are things that you cannot change. That is non-modifiable things, like your age, your gender, or your family history. You can't change you're old. You can't change that you're male, and you can't change your family history. But what you can change is your cholesterol by eating a great diet and by not choosing foods that are low in saturated fat. Not being sedentary. I know that's hard when you're in school, but a sedentary lifestyle, get up and move, make it a family thing. Don't use tobacco. And a hard one is your waist. If you're a man and you're greater than 40 inches around, that's a big sign that you are close to heart disease. If you're a woman and you're above 35 inches, then that is a big sign that you are experiencing some cardiovascular disease. Your heart is under pressure with all that fat in your abdomen is putting so much more pressure on your heart, your lungs, all those vital organs right there. So that's why we need to keep that abdomen fat off of our body. So, cardiovascular disease, coronary heart disease, we've talked about some. That's the blockage of the coronary arteries that supply the heart muscle, arteriosclerosis. Heart failure is the heart's unable to maintain adequate circulation because of excess sodium and fluid retention. So when the heart can't keep up with the demands of the body, that's called heart failure. And the right side of the heart normally collects the blood returning from the body and pumps it to the lungs to excrete carbon dioxide and absorb oxygen. If the right ventricle is failing, usually due to lung disease, the blood backs up into the veins that empty into the right atrium, and the patient will have signs of edema or swelling. If the patient has excess fluid volume and swelling, then the client, especially in the small bowel, then the client may have nausea. The left side of the heart normally receives oxygenated blood from the lungs and pumps it out into the left ventricle. If the left ventricle is failing, usually the myocardial infarction, by myocardial infarction, then the blood cannot be pumped effectively to the body, and it backs up into the blood vessels of the lungs. So the fluid from the blood is forced into the lung tissue, and that the patient will display shortness of breath. When you listen to their lungs, they're going to have this moist lung sound, and they may even have pink, frothy sputum. So, if the heart cannot pump enough blood to maintain blood pressure, the body has this response. It constricts the blood vessels, raising blood pressure. Hormones cause the kidneys to conserve sodium and water with it, and more fluids builds up in the blood vessels, causing higher blood pressure that pushes this fluid out into the extremities to cause edema. Obviously, when one side of the heart cannot function long, if the other side is failing. Therefore, nurses learn to look for early signs of heart failure in the extremities, if it's the right side of the heart, and in the lungs if it's the left side. All right. I just wanted you to know that tidbit. Myocardial infarction is an inadequate supply of oxygen to the myocardium. So it's a blockage, and we've talked about those two types of blockages. So what to do? Well, low-fat cholesterol diet, therapeutic lifestyle change. Okay, you want to change your diet, follow what we've talked about so far, have appropriate portion sizes, follow my plate. Make sure your cholesterol is down. Limit your saturated fat. Eat these things and do these things to help prevent. You can do these things listed here to help you with heart disease. I'll let you read those. So if you have 3 of these 5 factors, we've got a problem. If you have abdominal obesity, if your triglycerides is greater or equal to 150, if you have low HDL cholesterol, if you have increased blood pressure, hypertension, if your fasting blood sugar is greater than 100, then you need to be really thinking about making dietary lifestyle changes to help you with these factors so that you are not in the category of dying from one of the largest disease killers in America. Hypertension. Here's the numbers again. Here's the risk factors for hypertension. Look at that long list. It's a very long list. One that we haven't talked about yet is low potassium intake. That's why on your meal plans I was stressing half your plate is vegetables, half your plate is vegetables. But the best way to get potassium is through fruits and vegetables. So if you have a low intake of fruits and vegetables, you are increasing your risk of developing high blood pressure. The DASH diet, I had a student tell me they were on the DASH diet. And what is it? DASH diet is a great way to stop hypertension. It's where you purposely create a diet that is low in sodium. One way you can do that is to shop the perimeter of the grocery store. The perimeter of the grocery store is real food. That means it's been grown on a tree, on a plant. It is made from an animal, or it's real food. It didn't come from a factory. The aisles of a grocery store is your processed food. And in order to have that shelf life, they are putting so much sodium in that processed food, which is raising your blood pressure. So stay out of the aisles and shop the perimeter. That's where the real food is. Okay? Low fat, non-fat dairy to promote calcium intake. Another way you can have a lot of calcium is through green leafy vegetables. That's how that's how the milk got the calcium. The cow ate the grass. The calcium is in the grass. So it's a secondary source of calcium. So if you want to increase your calcium, green leafy vegetables is your friend. Limit your alcohol. Encourage your patients to read food labels, to pay attention to the sodium intake and write it down, add it up. Sometimes when we write it down, it becomes real, like our BMIs that we did. When we have to look at that number and then talk about it, it becomes real. Lifestyle changes. There are some books about the DASH diet. So, cardiovascular disease, heart failure. The inability of the heart to maintain adequate blood flow through the body. We've talked about this. Through excess sodium, fluid retention, edema. Here are the risk factors. What becomes of it. What you should do because of heart failure. Very similar to the others. Remember to increase your protein, but we don't necessarily want to make that all animal protein. There's so many ways to get protein through nuts, legumes, beans, lentils, tofu. We want to increase our sodium in other ways. Not sodium, increase our protein with different ways other than just one type of meat. Small, frequent meals that are soft and easy to chew. Can't find anything easier to chew than a bean or a lentil. Myocardial infarction occurs when there are inadequate supply of O2 to the myocardium. Frequently occurs because of arterial sclerosis. After this infarction, it's necessary to reduce the myocardial oxygen demands related to metabolic activity. So the risk factors are the same as cardiovascular disease. And here is what you would do as the nurse. You have a liquid diet for the first 24 hours. Caffeine should be avoided. I feel like that should have been on almost every one of them. If you have a heart issue, you don't want to load yourself up with caffeine and speed up your heart rate. Your heart's already working hard enough, so why would you put a lot of caffeine in it? Small, frequent meals are indicated, and definitely as the nurse, you will be counseling every one of your patients about a heart-healthy diet. And that's why I was so, I guess I should say strict, I don't know, about your meal planning. It's because you are designing a meal for yourself or for your family member that would provide the best optimal health. And so when you're working with patients, you want to know their disease process and help them the best way they can. And let's face it, nutrition is one of the simplest ways that we can help our patients improve their life, because what we eat is directly affected to our disease processes. So that is our slideshow today for coronary heart disease or cardiovascular disease. And I appreciate you listening, and I hope you have a wonderful evening.